Hello and welcome to the webinar, Keeping Homeless Children Safe from Lead Poisoning. My name is Melissa Da Silva and I will be acting as MC for today's webinar, which is a production of the National Healthcare for the Homeless Council, made possible by a national cooperative agreement from the Bureau of Primary Healthcare and the Health Resources and Services Administration of HHS. This is a 1-hour presentation with the last 10 minutes reserved for Q&A within 2 business days. Thank you again for joining us to learn more about our presenter, Todd Ziegler, and his presentation on lead poisoning. And now a little bit about Todd. Todd manages the National Nursing Centers Consortium's environmental health prevention program serving low-income and homeless families in Philadelphia. He currently coordinates the Lead Safe Babies Families in Transition program and the Asthma Healthcare Access Project. Todd has managed over $1.5 million in federal funding from CDC, the EPA, and HUD. His primary responsibilities include service delivery, community outreach, data collection and management, and quality control and accountability. In addition, Todd assists in developing programs and grant applications, as well as shifting the focus of service delivery to a healthy homes model of care. Todd specializes in GIS mapping and works to create maps and reports documenting the need and NNCC's expertise in delivering appropriate services to reduce environmental health disparities in Philadelphia. Woo! Todd, you do a lot. So I now turn the mic over to our presenter, Todd Ziegler, for today's presentation.
Thanks, Melissa, and thanks everyone for being on this webinar today. Today I'm going to talk to you a little bit about keeping homeless children safe from lead poisoning and also talk specifically about our primary lead prevention program for homeless families called the Lead Safe Babies Families in Transition program. So before I get started, I'd like to give a little background on my organization, the National Nursing Centers Consortium. The NNC is a national association of nurse-managed health centers working to provide critical health services in medically underserved communities throughout the United States. Nurse-managed health centers are community-based and run by advanced practice nurses. They focus on the needs of the community. They treat illness as well as promote health, and they work with their patients to understand the issues and situations concurrent with their health problems. They are proven to be a remarkable, effective means of providing affordable, accessible, and high-quality care. So, as an organization, we have 4 main focuses. Because we provide services to the uninsured and underinsured, we provide technical assistance and consultation services to our member centers to basically help them keep their doors open and get reimbursed for the services they provide. We also focus on policy to allow nurse practitioners to practice to the full extent of their training. We also initiate and participate in applied research to build the evidence base of programs and practices that improve health and wellness. And finally, we create health promotion programs to improve the health outcomes of our patients and communities. Our environmental health programming began at one of our nurse-managed health centers, Temple Health Connection in North Philadelphia. A large number of children at this particular center were being screened with high levels of lead in their blood. One of the nurses at the center recognized the limitations of providing lead prevention education in the clinic when the problems stem from the home environment. So based on the original home visiting nurse model, the Lead Safe Babies program was created to provide critical primary prevention education and services within the home before a child is poisoned. This program's model expanded beyond lead into additional indoor environmental hazards, including asthma and other healthy homes issues. So, those of us in the environmental health and public health fields are all too familiar with the health impacts of childhood lead poisoning. Exposure to lead primarily causes brain damage, negatively affecting cognitive development, leading to learning disabilities and behavior problems later in life. There's been a great deal of research linking early childhood lead poisoning with violent behavior later in life due to reduced serotonin levels in the brain and the subsequent inability to control inhibitions. In addition to the terrible health impacts of lead, it's also important to recognize the extraordinary economic impacts of childhood lead poisoning. According to a study in the Environmental Health Perspectives Journal, lead poisoning is the #1 most costly pediatric environmental disease in the United States, costing over $43 billion per year. So lead, where did it come from? Well, entire books have actually been written about the lead industry's influence on public policy, so I won't go into too much detail. While dozens of countries banned the use of lead paint in the early 1900s, the United States didn't ban lead in paint until 1978 due to a systematized attack on science and enormous campaign by the lead industry to keep lead legal in consumer paint. Additionally, lead was used in gasoline, releasing millions of tons of toxic lead into our soils, disproportionately affecting large urban areas. So lead dust is the #1 source of lead hazards to children in Philadelphia and other large American cities. Old deteriorated lead paint breaks down and turns to dust and settles on floors and windows. Children crawl on these surfaces and touch window sills where lead dust settles. Then children unknowingly put their lead-laced fingers into their mouths, poisoning themselves. The highest risk age for children is when they're teething, as hand-to-mouth activity is heightened during this developmental stage. Also, it's a myth to think that only kids who eat paint chips are poisoned. Most of that lead exposure does come from dust and normal hand-to-mouth activity. As well, it's important to identify and reduce lead dust. While it's important to identify and reduce lead dust as a source of lead exposure, it's also important to take note that lead can be found in other sources in the home, including imported toys, jewelry, and makeup. So, low-income communities are disproportionately affected by lead hazards. Anyone who knows me personally knows that I love maps, and as Melissa said, I do GIS mapping. These maps are often the easiest way to really show relationships. This slide shows a map of income on the left and lead risks on the right. While the colors are opposite, you can see that low-income areas on the left and high lead risk areas on the right are nearly identical. The reason for this correlation being the age and condition of housing and the economic means to control lead hazards and properly maintain housing. So, going back to the original Lead Safe Babies program, it was created over 10 years ago, as previously stated in our North Philadelphia Health Center Temple Health Connection. The model is based on home visitation and education on simple techniques to reduce lead hazards. We provide free cleaning supplies as a teaching tool regarding lead dust hazards. We utilize outreach workers from the community. We also provide lead dust swipes and partnerships with the local lead department to provide follow-up lead hazard control services. Finally, we also remind our clients to have their child screened for lead between the ages of 9 months and 1 year. These next two slides will illustrate our success in reaching the highest risk communities in Philadelphia. The dark red areas indicate census tracts with over 100 kids screened with moderate levels of lead in their blood above 5 micrograms per deciliter. And this next slide shows where our home visits took place. So you can clearly see the correlation and the concentration in these high-risk communities. We've accomplished a great number of successes over the years with Lead Safe Babies. We received the 2005 Children's Environmental Excellence Award from the EPA. We also have served over 10,000 families to date. We've replicated our program in Washington, D.C., and our evaluation results have shown a relative risk reduction in blood lead levels among children who participated in the program versus children outside the program in similar high-risk housing stock. So anyone who is involved in lead prevention or healthy homes realizes right now is a very difficult time as far as funding. So that's really our major challenge. Our program was heavily reliant on funding from the Centers for Disease Control, which has been cut significantly. Unfortunately, we're no longer able to provide in-home lead prevention services directly. However, the City Health Department has told us that they're continuing to provide a limited number of visits. Over the years, we have identified 2 underserved populations through the program, immigrants and refugees, and the homeless, which of course I'll be talking more in depth about. targeting the homeless population. I'd also like to take note that we've had success in innovating new approaches to lead poisoning prevention education previously. Our HUD-funded lead outreach program aimed to educate high-risk families in familiar and comfortable community settings. This program focused primarily on providing lead prevention education in neighborhood beauty salons. So moving along to lead and homeless children, why are homeless children at higher risk for lead poisoning? Well, according to the American Academy of Pediatrics, and common sense in my opinion, homeless children are more likely to come from substandard housing before moving into a shelter, and homeless children are part of a population with multiple known risk factors such as poverty and poor nutrition. According to a report entitled Philadelphia Children and Youth Experiencing Homelessness put out by the People's Emergency Center in Philadelphia, 6.9% of children in emergency housing are lead poisoned, at least above that current action level of 10 micrograms per deciliter, compared to just 2.9% of all children in Philadelphia. So we do know, thanks to this study, that homeless children here in Philadelphia are a high-risk population that we could target for lead poisoning prevention services. So the Lead Safe Babies Families in Transition program basically came about as an extension of the Lead Safe Babies program to target the homeless population in Philadelphia. Our goal is basically to ensure that homeless children and their families are connected to lead prevention services here in Philadelphia. And a basic summary of the program is the creation of a systematized approach to reaching homeless families with lead prevention services and education. Our program objectives include establishing partnerships with agencies currently providing services to homeless families with children, organizing and systematizing a process for connecting homeless children and their caregivers to lead prevention services, providing primary prevention education to homeless caregivers in shelters or transitional housing, working with program partners to refer clients into Lead Safe Babies program home visiting services once they are in stable housing, and working with our local lead department to provide education workshops to homeless shelter directors and their staff. So our funding comes from an EPA-targeted grant to reduce childhood lead poisoning. The funds for this particular grant are intended to reduce the incidence of lead poisoning in vulnerable and underserved communities. The goals of these funds are to reduce childhood lead poisoning in areas with high incidence of elevated blood lead levels through outreach and education, identifying and reducing lead poisoning in understudied areas with high potential for undocumented elevated blood lead levels through data gathering and monitoring, and developing tools to address unique and challenging issues in lead poisoning prevention, especially tools that are replicable and scalable for other areas. Outreach for Lead Safe Babies Families in Transition, or LSB-FiT for short, comes from our partnership with the ClearCorps program. ClearCorps is a branch of the AmeriCorps program and is funded by the Corporation for National and Community Service. Their mission is to provide low-income families by providing family-centered services to help them protect their children from lead poisoning and other environmental health threats. ClearCorps provides direct outreach through 4 distinct strategies, including lead screening, environmental education and training, community partnerships, and policy and advocacy. Also, as a side note, as an AmeriCorps Vista alumnus myself, I have an enormous amount of respect for what ClearCorps does, not only here but also across the nation. So the largest component of the Lead Safe Babies FiT program is group education workshops. I'll talk a little bit more about what they look like. We provide a simple, visually engaging, low literacy PowerPoint presentation on lead prevention techniques such as wet mopping and wet dusting, frequent hand washing, particularly before the child eats and sleeps, and healthy nutrition to prevent and reduce lead exposure. The next several slides will give you a short glimpse into our presentation. So we try to make this presentation visually appealing with limited amount of text. For example, you can keep your child safe, just 5 simple bullet points to give an overview of what we'll talk about in more detail during the workshop. We talk about lead dust. Showing an image of a child's fingers, I feel like, can really convey, how easily a child can be poisoned by simply putting their fingers in their mouth. Also, we just show pictures of kids actually putting their fingers in their mouth and letting families know that this is a normal part of the child's development, but it unfortunately puts their child at very high risk for lead poisoning. Washing children's hands, rather than just talking about it or putting images up on the screen, showing an image, much more powerful. We talk about lead and nutrition, and we have additional slides that really show what types of foods can help prevent lead poisoning, what types of food have iron, what types of food have calcium, what types of food have vitamin C, so that people can see for themselves. We talk a little bit about screening, ensuring that families get their children screened. Also, we talk about families finding out what their lead levels are. A lot of people who follow lead poisoning prevention realize that the Centers for Disease Control is also reducing their action level from 10 micrograms to 5. So there's a lot of research out there now that says, lead levels between 5 and 9 are high risk. So we really want our families to know what those numbers are, because unfortunately a lot of providers are still looking at lead poisoning as an on-off switch. If the lead levels are below 10, your child is okay. But in reality, we realize that lead poisoning is much more of a sliding scale. And if your child tests an 8 or a 9, they very well could test above a 10 later on down the line. And we basically tell our clients, you want to have those lead levels below 5. And this is my favorite picture because it illustrates that while your child may not appreciate getting stuck with a needle and having blood drawn, you will appreciate knowing that your child is lead safe, and that usually always, gets a bit of a reaction from the families in a lighthearted way. So basically our workshops, they're typically between 5 and 15, but we've had anywhere up to 30 and 40 clients. We will do one-on-one education as well if that works. We will partner with other organizations that are going into the centers to do immunization or other types of health services, and just talk to families one-on-one, really whatever works best for the partner. We provide educational handouts, information that families can take home. Also, we've designed coloring books that focus on lead poisoning prevention and healthy homes, and giving out crayons to the children who may not be able to sit still really through the workshop. So that's a tool to educate the child, educate the mom, and also make sure everybody is able to pay attention. We also provide pretty much any incentive or giveaway that we can. Unfortunately, the EPA, they don't fund gift cards, which we have used for our Lead Safe Babies program as an incentive to get people to stick with the program going through both home visits. But we, unfortunately, were not able to get gift cards for a short while, but eventually we were able to get an in-kind donation, and we really did notice an uptick in participation when we were able to put on the flyer that we're having a raffle and giving out these incentives. Typically we'll see a little more participation, and really the most important component of the workshop, I believe, is open dialogue. Families talking to each other, discussing situations. Almost every workshop we go to, there's at least one mom or more that have either a child who's been lead poisoned, or perhaps they were even lead poisoned themselves, which really makes for some interesting conversation. So some of the challenges that we've encountered is basically referring families into our home visiting program, because as I've discussed, our funding was really cut. So we're working a lot more with limited resources as far as being able to refer families into home visiting programs once they're in permanent housing. And then compounding on top of that is that the homeless population as folks who've worked with this population know that they're a difficult population to track. So each organization kind of is tracking their clients in different ways, which can make it a little bit tricky as far as referring families into home visits. In addition to that, sometimes attendance can be, an issue. There's clearly our expectations were that lead poisoning wasn't going to be really at the top of the list as far as concerns for families who are homeless. However, we've really noticed, across the spectrum, some families are really excited and eager to learn about this information. Other families, unfortunately, you can't quite get through to them. But we've really gotten a lot of support from all the different partners here, and just working with those partners that really have kind of given us the most support. So some of our successes as well, we've educated over 300 caregivers, 90 providers, and we've worked with a total of about 30 partners. Our success really stems from our commitment to partnerships and networking with any and every potential partner that we can. Simply showing up to homeless service provider meetings, stakeholder meetings, promoting our program, putting a face to the name, I really can't stress that enough. It's really helped us, especially, later on down the line, people become more familiar with the program, and they're more, willing to partner with us. Oftentimes these meetings that we go to, the focus will be on radically different issues, mental health, addiction services, and things like that. But really, our support here has been overwhelmingly positive. Consistent attendance, messaging, commitment really help build that trust and partnership. So simply another success is simply just raising awareness to this issue. I like to count that as one of our successes, with this webinar being an indication of that, kind of bringing together two, separate public health kind of fields that really in a lot of ways are related. When we're talking about housing, we really should also be talking about healthy homes. And I just want to short statement here is that advocating not just housing for the homeless, but healthy housing for the homeless is really a powerful and provocative message. And finally, we really feel empowered to be able to continue providing lead prevention services despite these drastic federal funding cuts. We've had a lot of experience providing lead poisoning prevention education, asthma, and healthy homes over the years, and it's been a struggle to be able to continue to do that. But this is an opportunity for us to really promote what we've done, what we're continuing to do, and reaching these vulnerable populations as well. So moving along, some of our key partners and networks right here in Philadelphia have been the Public Health Management Corporation's Healthcare for the Homeless Advisory Committee. Also, the Children's Hospital of Philadelphia, known as CHOP here in Philadelphia. The Homeless Health Initiative has been a really helpful partner in scheduling a lot of these workshops and building those relationships and partnerships. The People's Emergency Center, who also put out that study, they do a lot of networking opportunities for providers for homeless services. And of course, the City of Philadelphia, our Office of Supportive Housing, has been helpful as well. And our success really wouldn't have been able to happen without any of these, all these partners being invested. Additionally, some additional resources. If anyone who is not quite as familiar with lead or healthy homes and wants to gather more information, you can of course reach out to me, but these are some other sources. The National Center for Healthy Housing, they have a resource clearinghouse, a lot of information. They also have LeadNet and Healthy Homes Net, which I'm certain at least a few people on here found out about that because I posted on there. It's a great way to kind of share information, network, and build those relationships. Also reach out to your local health department. Find out if there's a lead or a healthy homes department within the health department. If you don't have a local health department, you can work with your state, or you can reach out to either the EPA or another federal agency, perhaps, for more information. And also check out ClearCore. It's a really great program and potentially an opportunity to do some lead in healthy homes programming in your community. So I really underestimated, I guess, how much time I was going to take. I kind of breezed through this pretty quickly, so I've got plenty of time to answer questions. If anybody has any questions, I will turn the mic over now to Melissa.
Thanks, Todd, for that terrific presentation. And we do have quite a few questions for you. So there are a couple of related questions from Joan and Micah. Let's see if I get this right. They are both interested in the outreach strategy, how outreach is conducted, how do you decide on the target audience, who is included in the target audience, and specifically Joan is interested in knowing whether faith-based organizations are considered as a part of your outreach strategy. Mike, back to you, Todd.
I don't think we've specifically targeted any faith-based organizations. However, a lot of the shelters here, I believe, are faith-based. We don't really make the distinction. We basically are just working with any and every shelter that we possibly can here in Philadelphia. And we, as far as our outreach staff comes from ClearCore. So I'm hoping I'm answering that question.
Thanks, Todd. We have another question about the reference to the change in lead action levels from 10 to 5. So Linda would like to know if the CDC has agreed to that change.
That's a good question. I am not certain that they have moved forward with that. I haven't been able to pay too close of attention, but if you go to the National Center for Healthy Housing, go on their website or contact someone from that organization, they'll be able to give you more information on that. They're following that issue very closely.
Thanks, Todd. Doris would like to know if it's possible for providers to obtain educational handouts, including tools for children, specifically coloring books, from some entity. And I'm assuming at no cost.
We did design our own coloring books, and unfortunately we have a very limited number of them. So we are looking for partners to purchase coloring books from us. As far as other resources, I'm not certain, but that's only something I could look into. If you want to contact me directly, I'd be happy to talk to you more about that.
Cool. And just a reminder to everyone, we will be posting Todd's contact information, this PowerPoint, and this recording on our website in 2 business days. The questions keep flowing in, and we have one now from Ms. Harris. Ms. Harris is an educational outreach worker at a health department, and she works in childhood lead poison prevention, and she would like to know exactly how you conduct the Lead Safe Babies program if the parent and child have no home. She's curious because she's not sure what you're testing at that point. And I believe you alluded to this in a slide around describing shelter.
Right. We don't actually do any testing in the shelter. If the family's in transitional housing, we can provide dust swipe testing to find out if there's lead hazards within their transitional housing. However, we're not really focused on testing, more so just on primary prevention education. So our workshops are specifically targeted to just providing education, telling families to get their child tested. If they have trouble finding a primary care provider, we can assist them in going to one of our nurse-managed health centers or one of the city health clinics to get their child tested. But as far as we're not doing any blood screening in the shelters or really any dust swipe testing unless we're in a more stable housing other than emergency housing.
Thanks, Todd. We have a question from Ingrid, who would like you to explain or describe further blood lead testing and screening procedures.
Sure. I'm not an expert in blood lead screening. However, I can tell you what I know. Philadelphia is a high-risk city, so what we recommend through our program is children get screened between the ages of 9 months and a year. Follow up 6 months after that first test, because usually around 18 months when we find kids are very high risk for lead poisoning because they're a lot more mobile, they're touching windowsills where there's a lot of lead dust, they're all over the place, they're sneezing, they're putting their fingers in the mouth. So around 18 months, another lead test, and then again at the ages of 2 and 3. Now the health department recommends up to the age of 3. However, we usually recommend continuing up to the age of 6 because we work with such high-risk populations. But I believe the city says up to 3, and unless a child hasn't had a screening within that first 3 years, then screening after that. But like I said, I'm not an expert. You could get more information on the CDC website or National Center for Health and Housing for more information on that, or reach out to me and I'll try to connect you with someone who maybe has a little more definitive information on that.
Thanks, Todd. Question, actually, Linda would like you to speak more about the Clean Core and the process to get clients involved.
Sure. ClearCore, as I mentioned, it's a division of AmeriCorps. There are several sites across the country, and as far as getting involved with ClearCore, I could connect you with someone at ClearCore to talk more about that. As far as the process, for getting involved, I'm not really the person to talk to. My supervisor kind of handles most of that. I do a little bit of the administration of that, but just get in touch with me and I can point you in the right direction.
Thanks, Todd. Tammy has a question about your take on, anticipated funding cuts for the various programs you've mentioned. And I guess her verbatim question, do you think the government will rethink the funding cuts given proven studies of how lead poisoning affects children?
I have no idea. But I do know that the National Center for Healthy Housing is really pushing to have this funding reinstated. I know they are really lobbying. They're having a lobbying day, I believe, early March. And you can get information on their website on that, or get on LeadNet and Healthy Homes Net, and you can connect with people to find out more information about that. I know that they're really actively pursuing getting this funding reinstated. We, as an organization, we've been told the strategy is to shift the funding over to the maternal and child health programs. We're not quite sure what that means yet. We're kind of looking at this from a policy perspective, but I'm not really heavily involved in policy. But our basic strategy is we don't really care where the money comes from, as long as we have access to that funding and continue to do what we've been doing to protect children from lead and healthy homes issues.
Thanks, Todd. Michael would like to know how you are tracking the evaluation of your educational efforts for transitional populations.
Sure. That's something we haven't quite gotten to yet as far as evaluating the program. We're still being funded, thankfully, for another few months. I believe we're going to try to get some information on blood lead levels. But as far as formal evaluation, give me a call or send me an email. I can kind of look back into it. I've been so focused on doing the actual program itself that I haven't quite got to that point yet where I know it's written into the proposal. I just kind of need to revisit it. So I apologize for not having that right here in front of me. We're talking about that more, but I'd be happy to share that with anybody that wants more information on that.
Thanks, Todd. There are quite a few questions that are really pointed and are directed at you and your relationship with other agencies that I'm going to handle via email. I'll send you because they're pretty involved questions. So I'm going to skip on to the more content to this webinar related questions. So Fausto asks, How cooperative has the local health department of homeless services been in identifying and or referring children who have elevated blood lead levels? And related, has the Department of Homeless Services in Philadelphia allowed increased access to their units for related testing?
That's a really good question. So the health department has been very cooperative with us as far as identifying and referring children with elevated blood levels. However, that was before all these funding cuts. So a lot of things have changed since then. We are really a primary prevention focused program. So we're really going out and trying to provide education in the home, or in this case, in shelters and transitional housing when the children are very young before they're poisoned, to provide that primary prevention education. So that, as far as identifying and children with elevated blood levels, that hasn't really been one of our strategies. As far as the homeless services here in Philadelphia through the city, I'm not aware of any XRS testing or even any funding available for that, but that's certainly an interesting, question and something that we definitely have discussed, but we will continue to look into seeing if that's something we could provide.
Thanks, Todd. We have another question from Michael, and he asks, what type of healthy housing interventions are you providing clients?
So right now, this program, we are just providing lead education in shelters and transitional housing. So basic education and information on how, parents can keep their children safe from lead, hand washing, wet mopping and wet dusting, nutrition, and screening. We also have another program where we are focusing on asthma, and we are working with a local emergency department and referring families who have a child with asthma who has been into the emergency department in the last 2 months to provide asthma-focused education, as well as identifying asthma triggers in the home and providing supplies and education and information to try to reduce asthma triggers in the home. So those are the two main environmental programs we have right now, and basically the extent of our healthy housing interventions. We have had programs in the past. We've had a program called Healthy Homes for Child Care, where we were going into home-based daycares and providing a more comprehensive healthy housing intervention and education, talking about carbon monoxide, talking about pest management, talking about safety issues, mold, and things like that. So we're using more of the healthy homes model in that, which is kind of I believe CDC kind of came up with this model, and HUD has a model as well. So we were more focusing on that comprehensive healthy homes model for that program. But right now, with the funding cuts, we haven't really been able to provide much as far as comprehensive healthy homes intervention.
Thanks, Todd. Julie would like to know, or she would like you to describe your outreach to medical providers to increase their screening rates, and she would also like to know of any successful strategies that you're aware of to increase the percentage of parents that complete the testing process, considering the, travel required and time required for doctor's visits, doctor's office visits, and then outside labs and possibly others.
Yeah, that's a great question as well. We have kind of done a limited amount of provider education. We have gotten a few small grants, I believe, through the EPA, where we have been trying to reach out to providers to provide education on lead screening and also indoor environmental health hazards as far as asthma. So we've basically just been trying to get funding to do that, and I can talk to you more about some of the outcomes from those and specifics about those programs individually. But as far as an overall technique to increase percentage, we haven't quite gotten there yet. We're just kind of doing what we can with these small steps. But as far as a big kind of grand plan, there's none that I'm aware of. I know we meet with a local organization called Public Citizens for Children and Youth that really, they're a children's advocacy organization, and they have a working group that focuses on lead specifically, and they have been trying to develop strategies for this as well. Unfortunately, not really something that we're actively pursuing at this time, but it's certainly one of our strategies that we hope to try to increase the screening rates across the board. But I'd be, again, happy to talk individually about that as well.
Thanks, Todd. Joanne would like to know if, I guess, your organization provides prevention information in languages other than English.
Sure. Currently, right now, our Let's Say Baby Family Transition, we already have one outreach worker who is English speaking only. The city lead department, I believe, utilizes a language translation phone line where they can have their clients call in and their information can be translated on the spot. As far as also, the city has been working with separate organizations to target the immigrant and refugee communities. So we have two additional organizations that are specifically targeting these populations. So I hope that answers your question.
You're more than just, Todd. Thank you. We have a question from Doris again. She would like to know some strategies for working with landlords regarding lead safety and when trying to get homeless families into rentals.
Sure, that's a great question. There actually has been legislation passed here in Philadelphia just recently, modeled on the Washington, D.C. law that requires landlords to do an assessment and pass dust swipe testing in the hall before families are able to move in. So that has been a strategy across the board to protect all families in rental units, not just homeless families. As far as particular organizations serving the homeless moving into private housing through landlords, I'm not entirely certain of what the strategies they're using, but that's certainly something that we can discuss internally, and I'd be happy to talk to you more about as well.
Thanks, Todd. I'm scrolling through the chat box to see if I've missed any that we could respond to here, and I don't think so. Again, there were a couple questions that were pretty involved, and I think best left for an email exchange.
Sure.
So that said, I want to thank all of you. We had over 130 participants for today's webinar, which is remarkable. So thank you all for participating in today's webinar. Thank you for your terrific questions. Thank you, Todd, for this amazing presentation and for bringing it to our members and HCH grantees. Do you have any final thoughts or words for our participants?
I just want to thank everyone for participating. I feel like this has really been an exciting opportunity to kind of, like I said earlier, bring together two fields that often seem disconnected, but I feel like this is an opportunity for all of us to recognize, that healthy homes is an issue across the board when it comes to homeless, families and those of us who are working with other populations as well. I want to thank Melissa De Silva as well and the National Healthcare for the Homeless Council for putting this all together. I really appreciate you organizing this so that we can kind of spread our message and what we're doing here to try to keep homeless kids safe from lead poisoning. So thank you.
Thank you, Todd, very much. Thank you, everyone, again for joining us on today's webinar. I'd like to direct your attention now to some resources on the Council website at www.nhchc.org, and also remind you that this webinar will be archived on our website in 2 business days. For those questions that we did not get to during this hour, we will follow up by email directly with Todd. And please join us at our national conference in May in Kansas City, Missouri. Join us for pre-conference on the 15th. We'll have some exciting one-day pre-conference topics, patient-centered medical home, meaningful use, chronic pain, motivational interviewing, among others. Please do not hesitate to reach out to us with any further questions or requests for other webinar presentations. You can, again, find all our contact information on our website at www.nhchc.org. Thanks and have a great day.